Welcome. Today we will be starting the respiratory system. By the end of this chapter, you should be able to do the following learning objectives. Explain the structure and functions of the respiratory system. Define respiration. List the organs of the respiratory system and divide them into upper and lower respiratory tract. List the locations and functions of the various types of epithelium that line the respiratory tract. Describe the structures and functions of the internal and external nose and the three regions of the pharynx, the larynx, and the trachea. Discuss the role of the epiglottis during swallowing. Discuss the role of the vocal cords in sound production. Describe the gross anatomy of the lower respiratory tract. Define atmospheric, interpleural, and intrapulmonic pressure. Describe the process of inspiration and expiration. Define compliance and list conditions which affect it. Explain airway resistance and list conditions which affect it. Define and relate perfusion and ventilation. List the normal male values for the lung capacities and volumes. Discuss the exchange of gases in the alveoli and blood, including partial pressures of oxygen and carbon dioxide. Describe the transport of carbon dioxide and oxygen by the blood. Discuss the relationship of respiration and acid-base balance in the blood. And lastly, describe the neural control of respiration. Understanding the anatomy and function of the respiratory system will help in assessing and treating patients with respiratory disorders. The respiratory system functions to supply the body with oxygen for cellular respiration and to dispose of carbon dioxide, the waste product of cellular respiration. It also assists in olfaction and speech. Respiration involves four processes. The two processes in the respiratory system are first, pulmonary ventilation or breathing. This is the movement of air into and out of the lungs. And also external respiration, which is the exchange of oxygen and carbon dioxide between the lungs and the blood. Respiration also involves two processes found in the circulatory system, the transport of oxygen and carbon dioxide by the blood, and internal respiration, which is the exchange of oxygen and carbon dioxide between the system's blood vessels and tissues. Let's begin with the functional anatomy of the respiratory system. The major organs of the upper respiratory system are the nose and nasal cavity, the paranasal sinuses, and the pharynx. The major organs of the lower respiratory system are the larynx, trachea, bronchi and their branches, and the lungs and alveoli. Excuse me. Figure 22.1 illustrates the main respiratory organs. So we see the larynx, the pharynx, the nasal cavity, the oral cavity, the main bronchi, the lungs, and also the trachea. Table 22.1 goes through the upper respiratory tract. The nose and nasal cavity produce mucus, filters, warms, and moistens incoming air. They are also a resonance chamber for speech. The roof of the nasal cavity contains the olfactory epithelium, where the receptors for the sense of smell are located. The paranasal sinuses lighten the skull, warm, moisten, and filter incoming air. The pharynx is a passageway for air and food. It facilitates the immune system's exposure to inhaled antigens. The lower respiratory system includes the larynx, which is an air passageway and prevents food from entering the lower respiratory tract. The larynx houses the vocal cords and is responsible for voice production. The trachea is an air passageway that cleans, warms, and moistens incoming air. The bronchial tree are air passageways connecting the trachea with the alveoli. They also clean, warm, and moisten incoming air. The alveoli are the main gas exchange sites in the lungs. They produce surfactant to reduce surface tension and prevent lung collapse. The lungs house the respiratory passages smaller than the main bronchi. The pleurae are serous membranes which produce lubricating fluid and compartmentalize the lungs. Now we will go into more depth about the upper respiratory system, beginning with the nose and paranasal sinuses. The nose is the only external part of the respiratory system. Its functions are to provide an airway for respiration, to moisten and warm entering air, to filter and clean inspired air, to resonate one's speech, and house olfactory receptors. It is divided into the external nose and the nasal cavity. The external nose includes the root, the area between one's eyebrows, the bridge, the dorsum nasi, the anterior margin, and the apex, which is the tip of the nose. The nostrils, also known as nares, are bounded laterally by ala. The external nose is formed by nasal and frontal bones superiorly, maxillary bones laterally, and hyaline cartilage inferiorly. The nasal cavity is within and posterior to the external nose. It is divided by the nasal septum. The anterior septum is made up of septal cartilage, and the posterior septum is made of the vomer and perpendicular plate of the ethmoid bone. The posterior nasal aperture, or choanae, are openings where the nasal cavity turns into the nasopharynx. The roof of the nasal cavity is formed by the ethmoid and sphenoid bones. The floor is formed by the hard and soft palates. The nasal vestibule is the nasal cavity superior to the nostrils. It is lined with vibraceae, or hairs, that filter coarse particles from the inspired air. The rest of the nasal cavity is lined with mucous membranes. The olfactory mucosa line the superior region of the nasal cavity and contain olfactory epithelium. The respiratory mucosa is pseudostratified ciliated columnar epithelium with goblet cells that rest on the lamina propria. It contains many seromucous nasal glands. Excuse me. The seromucous nasal glands contain both mucus-secreting mucus cells and serous cells. Serous cells secrete a watery fluid containing enzymes. Mucus and serous secretions also contain lysozyme and defensins. Ciliated cells sweep contaminated mucus posteriorly towards the throat. Inspired air is warmed by the capillary plexuses and veins in the nasal cavity. Nasal mucosa contains many sensory nerve endings that can cause sneezing to force particles out of the cavity. The nasal conchae are scroll-like mucosa-covered projections which protrude medially from each lateral nasal cavity wall. There are three sections: the superior, middle, and inferior conchae. The nasal meatus is the groove interior to each concha. Their shape help concha to increase mucosal area and air turbulence. During inhalation, the concha and nasal mucosa filter, heat, and moisten the air. And during exhalation, these structures reclaim the heat and moisture. The paranasal sinuses form a ring around the nasal cavities. They are located in the frontal, sphenoid, ethmoid, and maxillary bones. Their function is to lighten the skull, secrete mucus, and help warm and moisten the air. Figure 22.3a shows the sphenoidal, frontal sinuses as well as the conchae. So here's a sphenoidal sinus, the different conchae here, and here's the frontal sinus. Rhinitis is the inflammation of the nasal mucosa. Because the nasal mucosa and respiratory tract are continuous, infections spread from the nose to the throat to the chest. Infections can also spread to tear ducts and paranasal sinuses, causing blockages in the sinus passageways. This can lead to the absorption of air, producing a vacuum, which results in a sinus headache. The pharynx is a funnel-shaped muscular tube that runs from the base of the skull to the C6 vertebra. It connects the nasal cavity in the mouth to the larynx and the esophagus. It's composed of skeletal muscle, and there are three regions: the nasopharynx, oropharynx, and laryngopharynx. Starting with the most superior portion, the nasopharynx. It is an air passageway located posterior to the nasal cavity. Its lining contains pseudostratified columnar epithelium. During swallowing, the soft palate and uvula close the nasopharynx. Pharyngeal tonsils, also known as the adenoids, are located on the posterior wall. Pharyngotympanic tubes, or auditory tubes, drain and equalize the pressure of the middle ear. The oropharynx is a passageway for both food and air, and it leads from the level of the soft palate to the epiglottis. Its lining is stratified squamous epithelium. So notice when food is introduced, now we have cells that accommodate friction and abrasion, the stratified squamous epithelium. Excuse me. The isthmus of fauces is the opening to the oral cavity. The palatine tonsils are located on the lateral walls of the fauces, whereas the linguinal tonsils are located on the posterior surface of the tongue. The laryngopharynx is a passageway for food and air. It is posterior to the epiglottis and extends to the larynx, where it is continuous with the esophagus. It is also lined with stratified squamous epithelium. Figure 22.4b illustrates the different areas of the pharynx. Most superior, we see the nasopharynx, followed by the oropharynx, where food enters the tube, and lastly the laryngopharynx, which leads to the esophagus. Here's the esophagus, and there's the trachea. The epiglottis walls off the larynx from aspiring food traveling down the esophagus. So when we swallow, food's going to come in here, and it's going to go down the esophagus and not into the trachea, into our airways, because we have this epiglottis right here. Okay? A fairly common problem is infected and swollen adenoids. They can block air passage in the nasopharynx, resulting in mouth breathing. As a result, air is not properly moistened, warmed, or filtered before reaching the lungs. When they are chronically enlarged, both speech and sleep may be affected. The lower respiratory tract consists of the larynx, trachea, bronchi, and lungs. It is broken down into the respiratory and conducting zones. The respiratory zone is the site of gas exchange and consists of the respiratory bronchioles, alveolar ducts, and the alveoli. The conducting zone is a conduit that transports gas to and from the gas exchange sites. It includes all the other respiratory structures. The conducting zone also cleanses, warms, and humidifies the air. The larynx, or voice box, extends from the 3rd to the 6th cervical vertebra and attaches to the hyoid bone. It opens into the laryngopharynx and is continuous with the trachea. The three functions of the larynx are: first, to provide a patent airway; second, it routes air and food into the proper channels; and lastly, it houses the vocal cords and produces our speech.